Welcome back to The Blend. The official start of summer is this Friday, and many of us, if we haven't already, will be busy barbecuing, swimming, or heading outside for some other fun. Got to make sure, though, that you protect your skin from those awful rays.
Here to make sure that we do, Healthcare Partners Nevada physician assistant Blanca Tenhet. Good morning to you, Blanca.
Hello. Thanks for having me.
People love to be outside during the summertime. It's the break for the kids. They're swimming, running, jogging, things like that. But you got to be very careful when you're outside, don't you?
Oh, I agree. I agree. We got up to the hundreds faster than you can think about.
Wow.
Yeah.
So all of a sudden, everybody's outside playing, enjoying a good time. Kids are out for the summer. We really have to be careful with the children and the senior citizens primarily, because they are just out there. They're having a blast. They're not really paying attention to hydration. So it's really important that we watch for them and the signs of overheating. The seniors the same way. You have to consider that senior citizens are taking medicines, maybe some diuretics, and that could certainly cause an increase in dehydration that you and I might not experience.
No question. So. When we're outside, we're having fun. We might lose track of time.
Absolutely.
How do we know it's like time maybe to take a break from the outside for a bit?
That's a good question. It's very simple. We have a lot of very specific signs of getting dehydrated. One of them is feeling really thirsty. People may get really flushed. They may have sense that their skin's really nice and hot, more than usual. Can't seem to cool down. Nausea, sometimes even vomiting. In worst cases, people can get really dizzy and pass out.
Wow.
And that's definitely scary situations. So.
But not only can you suffer from dehydration, also from sun exposure, too.
And heat exhaustion in more severe cases. Not going in to cool down when you're getting into those heat illnesses can certainly lead to very, grave, serious problems.
So if you feel really red or you look pink, I mean, you're on your way.
The clamminess.
So if that's the case, then just start drinking lots of water.
Hydration is very important. Going into a cooler area. If you're out in the park, always recommend finding some shade somewhere to cool down. That's always helpful tips.
Now, if heaven forbid you were out for a little too long, you had a sunburn, what's the best way to treat that?
We take a nice cold shower, consider some aloe vera, things like that, and hydrate. Hydrate, hydrate, hydrate. I couldn't stress that more. People always think I'm drinking plenty of water, and they really aren't when you consider how long you've been outside and how hot it is.
Now, is this a myth? Do you have to go and wait at least like 30 minutes after eating before going swimming? Is that...
Well, it's
an urban legend. It has.
It is. I mean, we have, yes, there's blood flow diverted to the stomach to take care of digestion, but at the same time, there's plenty of other blood flow. If you're healthy, you can get back in the water. I do want to encourage people to just be really careful if you're drinking. Pool parties. There's a lot of pool parties, 4th of July coming up. There's a lot of alcohol involved. I don't recommend that people get out there and drink and then get into the water. Maybe your pool or lake meet, to be really careful with not getting in the water after you've been drinking excessively.
So what are some of the things you see most during the summertime? Is it sunburns? What would you say?
Sunburns, heat exhaustions, people feeling like they overdid it, feeling dizzy and nauseated for the couple of days after being outside in the heat for an excessive amount of time. They come in the clinic and they're saying that they're not feeling good. I was out in the park yesterday for a birthday party, and I thought I was drinking plenty of water, and I've been feeling sick for the last 2 days and so forth. So
now,
we see a lot of that.
Are there over-the-counter medications that you can take also, or you should check with your doctor first?
I think you should speak to your doctor, because a lot of the advice that we provide is the hydration, the staying cool, the staying out of the sun, the sun exposure as far as sunblock and protecting yourself.
Now, I've heard if you feel thirsty, it's already too late. You're already dehydrated.
At that point, you're already dehydrated.
See, so it should just be a constant thing.
Just a constant drinking and get into a cooler area. Find some shade, get inside for a little bit and cool down.
Should you be drinking a certain amount of water depending upon your weight, or is just...
You should base it on your symptoms, base it on feeling thirsty. You should base it on how long you've been outside. You should base it on, if you're outside consecutively. Little kids play outside every day in the summer because they're out of school. So be sure that they're drinking plenty of water all day long as they go.
Now, you're at the North Nellis location of Healthcare Partners Nevada. How are you enjoying it there? And tell us all about Healthcare Partners.
I love it. It's a great clinic. We have a wonderful staff. We have a medical residents. I mean, it's a great clinic in an area that really needed to have full functioning providers to take care of that neighborhood. And I was raised in that area, so it's nice to give back.
Nice.
Now, this time of the year, do you find that kids are getting more bumps and bruises and coming in to see the doctor for that?
Absolutely. They're outside playing on their bikes, or we should be.
Yes, I wish. Wouldn't that be great? Healthcare Partners, for those who don't know, total care model. Explain that.
Total care model, we want to be sure that we take care of pretty much everything that has to do with the needs of our patient. We focus on chronic health issues as well as acute care, care issues. So we want to be sure that we address everything. There's a lot of chronic health issues with our seniors. simple symptoms, obesity and hypertension and diabetes, all these things, we want to be sure that we focus on everything and care for everybody the way we would our own family. So it's great.
Well, thank you, Blanca.
Thank you for having me.
All right.
For more information on taking the proper precaution from the sun, visit the website on your screen or call the number. You can find Blanca at the North Nellis location. Still